Welcome to Deep Reasoning AI. We provide cutting-edge technology for personalized 3D anatomical modeling. By leveraging CT imaging, we generate precise, sub-millimeter, clinically accurate 3D models, all within minutes. Take, for instance, a spine and pelvis model from a 97-year-old patient, where each vertebra is precisely segmented and distinguished with unique masks. Notice the detailed compression of the 7th thoracic vertebra, which can be isolated for focused examination. Our fine-grained 3D modeling unlocks extensive structural insights, enabling comprehensive analyses like bone density estimation, spinal curvature, load balance, and intervertebral disc height. Our system, powered by Deep Reasoning 3D engine, which combines deep learning and anatomical knowledge, is robust to anomalies and metal artifacts. For a patient with numerous lumbar implants, our model precisely segments vertebrae and identifies metal, despite significant CT scan noise. Consider an extreme scoliosis case with pedicle screws. Our algorithm remains unfazed, demonstrating versatility across various anatomical anomalies. We compared our model against leading industry benchmarks, and as demonstrated in the slides, the Deep Reasoning AI algorithm consistently outperforms them across a wide range of spine cases. In a simple adult spine case, Deep Reasoning AI generates a clean, fully labeled model with a DICE score of 0.930. In contrast, Total Segmentator loses anatomical detail. NVIDIA Clara fails entirely, and an FDA-cleared benchmark still mislabels vertebrae even with radiologist assistance. When scoliosis and metal implants complicate the anatomy, our algorithm accurately captures every screw and vertebra, while the benchmark models fail precisely at the areas of critical deformity. Several additional cases further highlight our capabilities. With the integration of Reasoning Module, the Deep Reasoning AI algorithm handles variations in anatomy, skin quality, patient size, and other confounding factors with ease, achieving superhuman performance across all ages and levels of complexity. In pediatric spine segmentation, a particularly difficult task due to smaller structures and variable development, our algorithm delivers complete, accurate outputs, while other models return either empty results or fragmented, unusable output. Our algorithm provides comprehensive coverage of a wide range of anatomical structures, including the cranio-maxillofacial region, fibula, and contrast-enhanced vessels, and delivers a detailed, accurate representation of the entire human skeleton. Both full skeleton models and anatomy-specific models can be customized to suit a variety of clinical applications. For facial reconstruction surgery, our Deep Reasoning AI models deliver precise, anatomy-aware segmentation of the cranio-maxillofacial region, mandible, and fibula, including detailed representations of bones and arteries. These models are designed to assist surgeons in accurately harvesting a small segment of the fibula bone for mandible reconstruction, ensuring optimal fit and function. Unlike conventional image processing software, which often produces artificial holes in critical areas like the orbital region, our cranio-maxillofacial model preserves true anatomical structures and maintains the integrity of key canals. To support fibula flap planning, our algorithm accurately segments both the leg bones and the surrounding vascular structures, helping to protect critical vessels during harvesting. Beyond the fibular arteries, our Deep Reasoning AI framework enables full-body vessel tracking, including cerebral, carotid, and cardiovascular systems. In the upcoming sections, we'll showcase our aorta-iliac femoral AIF model, along with our cerebral and carotid artery models, demonstrating the power and precision of our platform across multiple domains. Our Deep Reasoning AI, aorta-iliac femoral, AIF model turns routine CT angiography into a personalized 3D digital twin. It automatically delineates the thoracic and abdominal aorta, the common and external iliac arteries, femoral runoff, and key secondary branches, then seamlessly fuses these vessels with a high-fidelity, full-body skeletal model. The result is a single, anatomically coherent data set that allows clinicians to evaluate endograft landing zones, access angles, and critical bony landmarks at a glance. The algorithm also detects intraluminal calcium with submillimeter precision and stays accurate even in the presence of aneurysms, endovascular stents, or heavy metal artifacts. By reasoning over both vascular and osseous cues, the AIF model provides comprehensive, artifact-robust insight for truly personalized treatment planning. Moreover, by fusing our full-body skeletal segmentation with the AIF vascular model, we can generate anatomically registered maximum intensity projection (MIP) views from the raw CTA in a single click. These MIPs offer an instant, high-contrast roadmap that accelerates diagnosis, procedural planning, and clinical communication. In this CT angiography case, our AIF model delivers a highly detailed 3D reconstruction of the entire aortoiliac tree, even in the presence of complex pathology and stents. Previous endovascular repair is also captured. Twin stent graft limbs bifurcate the aorta into two dedicated channels feeding the left and right iliac arteries, and the model cleanly traces each metallic tunnel without artifact-induced gaps. The axial view panel reveals a crescent-shaped intraluminal thrombus adherent to the aortic wall. The algorithm accurately isolates this non-enhancing clot while preserving the patent lumen. When fused into a single, anatomically coherent 3D model, the vessel segmentation, stent geometry, and branch network are rendered with submillimeter fidelity, providing clinicians an intuitive, rotation-ready roadmap for assessing thrombus burden, graft apposition, and future access routes. In this lower extremity CTA, our algorithm generates a high-fidelity 3D model that merges skeletal anatomy with the full arterial tree, from the common iliacs and femoral popliteal segments all the way to the anterior, posterior tibial and pedal branches. It preserves submillimeter vessels and bone landmarks in a single model, giving clinicians a precise roadmap for diagnosing limb ischemia and planning endovascular or surgical revascularization. Our arterial model traces the vasculature continuously from the extracranial carotid and vertebral arteries into the intracranial circulation, capturing the circle of Willis and its major cortical branches in a single 3D model. In this study, the algorithm also flags dense calcific atheroma at the carotid bifurcations and along the proximal internal carotid arteries. As the axial slice illustrates, the vessel mask conforms precisely to the contrast-filled lumen without encroaching upon adjacent osseous structures, providing a clean, anatomically faithful data set for comprehensive cerebrovascular assessment. In addition to 3D models generated from CT images, we offer high-precision spine and pelvis 3D modeling derived from 2D X-ray images. Given frontal and lateral X-ray views, our algorithm infers anatomical structures by co-registering the anatomy from both perspectives and integrating spatial information to reconstruct accurate 3D models of individual bones. Unlike systems that require synchronized imaging, for example, the YOS system, our method does not impose such constraints, provided that the two X-ray images are captured within a short time interval. Furthermore, our model is robust to a variety of confounding factors, including spinal deformities such as scoliosis and obstructive materials like aluminium shielding. This case exhibits significant scoliosis, and our model accurately captures the full extent of the rotation and curvature, along with the detailed structure of each vertebra. Here is another example featuring aluminium shielding and additional metallic structures used for calibration purposes. Despite these artifacts, our model remains robust and accurately reconstructs the 3D anatomy of both the spine and pelvis. Once the 3D reconstruction is complete, anatomical landmarks can be automatically identified to enable precise measurement of clinical parameters such as spinal balance, cob angle, and vertebral axial rotation. For additional demonstrations and comparative insights, visit our website and feel free to contact Tomkers at the following email address.